Your dad is walking to work one morning, and suddenly he starts to experience shortness of breath, chest pain, and dizziness. He feels pressure in his chest and begins to sweat profusely. What your dad is likely experiencing is a heart attack.
You alright? You okay? You're gonna call for help. I'd like to report an emergency.
It feels like my chest is on fire.
In real life, heart attacks are a lot less obvious and would present something like this.
Jeez, Mike, you okay?
Yeah, I think I just got like a cramp or something.
Oh, let's sit down. Okay?
Oh, jeez.
Yeah. Here, I'm gonna call for help.
Okay.
I'd like to report an emergency.
So, what happens during a heart attack? Every step we take requires the action of the heart. The heart beats at 70 to 100 beats per minute, supplying blood and oxygen to vital organs and muscles throughout the body. But your heart is a muscle too, and therefore requires adequate oxygen to function. The coronary arteries are responsible for delivering blood to the heart, and when a problem occurs in one of these arteries, a heart attack may follow. This manifests as chest, shoulder, and back pain, shortness of breath, lightheadedness, nausea, and vomiting. When this is experienced, one must call 911 immediately. But what exactly is happening with these coronary arteries? Here's an image of a coronary artery with fatty deposits or plaque lining the artery wall. This plaque is formed by a buildup of fat, cholesterol, and other substances like calcium. As plaque builds up, the artery becomes more and more narrow, and the blood flow to the heart is restricted. Over time, the plaque becomes unstable and begins to rupture. To prevent this, a blood clot begins to form in the artery. If this blood clot becomes large enough, it can completely block the coronary artery, preventing blood and oxygen from reaching the heart. Without oxygen, the heart tissue dies. These areas of dead tissue are called infarcts. This is how a heart attack occurs. But what can be done to prevent the buildup of plaque and decrease our heart attack risk? For starters, we can move that booty. Many risk factors of plaque buildup, such as hypertension, obesity, and insulin resistance, can be decreased with exercise. It has recently been demonstrated that moderate intensity exercise can reduce the inflammation and immune response involved in the development of plaques. Moreover, exercise has been shown to increase dilation of the coronary arteries, thereby allowing more blood to reach the heart. Another thing we can do is fuel our body with healthy foods. Choose foods that are low in saturated fat, trans fat, and sodium. Eat plenty of fruits and veggies, high fiber whole grains, and foods that are high in omega-3 fatty acids such as fish. Choose lower fat dairy products, lean meats, and stay away from sugary drinks like pop. Don't forget to take it easy every once in a while. Find a relaxation method that works best for you. Yoga, meditation, reading, it all works. By participating in activities aimed at lowering stress levels, there is a decrease in circulating molecules known as catecholamines. This results in a decrease in heart rate and therefore a decrease in the heart's oxygen demand. Last, but certainly not least, quit now. If you've never started smoking, perfect. If you've recently quit, fantastic. But if you still smoke, stop right now. Smoking increases blood pressure and increases the tendency of blood to clot. Even secondhand smoke poses a risk. In fact, individuals exposed to secondhand smoke are actually 30% more likely to develop heart disease. There are lots of ways to lower your future heart attack risk, but it's up to you to make a difference.
Hey Alex, how you doing?
Hey Mike, how are you?
Yeah, good, yourself?
Looking good.
Thanks. I just got back from the gym actually.
Nice.
Alright, how'd the flyers turn out?
Turned out pretty good.
Cool. Oh, those look great. Alright, let's go check out my office.
Perfect.